My Lords, I beg leave to ask the question standing in my name on the order paper.
My Lords, long-term sickness is now the most common reason for economic inactivity among the working-age population. Those reporting being long-term sick or disabled as their main reason for economic inactivity has grown by 550,000 over the last 4 years to a total of 2.6 million people. We therefore announced a wide-reaching package at Spring Budget to support disabled people and people with health conditions to work, building on our existing package of support.
I thank the Minister for his response, but our nation's deteriorating health requires urgent and in-depth analysis. The increase of the 500,000 on long-term sick leave is estimated to hit our economic output and productivity by between 30 to 50 billion pounds per annum. Add to that our annual benefits bill for inactive working age people has grown by 35 billion in the last 3 years. It's a vicious circle. Less economic activity, less tax revenue, less funds for healthcare, soaring benefits bills. So can I ask, when will we see insightful data on what lies behind the record 2.6 million long-term sick, linked to NHS performance, particularly preventative healthcare?
My Lords, the Prime Minister tasked my right honourable friend, the Secretary of State for Work and Pensions, to look at the issue of workforce participation working across government. The government is focused on supporting those groups where inactivity levels are higher and so employment support is most needed, including the long-term sick, disabled, welfare recipients, people aged over 50 and parents. To tackle rising economic inactivity due to long-term sickness, a wide-ranging package was announced at the Spring Budget to support disabled people and people with health conditions to work. New investment broadens access to additional work coach support for disabled people and people with health conditions, introduces new support employment programme and focuses on providing faster access to joined-up work and health support.
My Lords, I welcome the Government's incentives for occupational health in SMEs and medium-sized enterprise and the Health and Disability White Paper. But can I also ask whether the Government is considering embedding occupational therapists within GP practices for those who are self-employed?
Well, the Health and Disability White Paper published in March sets out plans to transform the future system to support more disabled people to start, stay and succeed in work. We will reform the benefits system so it focuses on what people can do. But in terms of the Noble Lady's specific points, to my knowledge, GP practices are innovating and introducing such measures, but it does need to be expanded further.
The government spent 13 years taking away money from the most deprived communities in Britain. Does he accept that the link between poor health and the money that's being reduced in those communities?
My Lords, it's great to see the Noble Lord in his place. I had déjà vu when I saw him sat there from the House of Commons from his green benches. He's got exactly the same place to give those exocet questions. But what I would say to him in terms of specifically to his question, health can be linked to welfare payments and indeed to health, but it's also linked to unemployment because people who are in work, in good quality work, benefits their health and well-being and the health and well-being of all communities.
My Lords, when chronic fatigue contributes, whether triggered by by COVID or by some other virus, contributes so substantially to the numbers of economically inactive, can the Minister explain what progress has been made to find a treatment for these very, very severely handicapped patients? And can he explain what the government is doing to make sure a treatment is urgently found?
Well, the Noble Lady asks a very difficult question which I can't answer in full, but what I can say is that the government is supporting disabled people and has done for over a decade now. It's very important that people who can work should work, and that includes to disabled people. But I can't give a fulsome response to the noble lady's question, so I will write to her.
My Lords, the data shows that there has been a significant and worrying increase in the number of people leaving work because of long-term illness and disability. And it's in everyone's interest that everything possible is done to keep people in work as their conditions develop. In that respect, and following the previous question around occupational health, what is the government doing to ensure that there are sufficient occupational health professionals available to support all of the businesses that need them? And will this profession be part of the long-awaited workforce development plan that we're looking for from the government?
Well, the noble lord is absolutely right to talk about data and how we can learn from data, but it's currently difficult to quantify the direct effects of this, but it is indeed a factor. Data on employment rates suggests that those awaiting treatment were often already inactive before COVID, and therefore it is possible that longer waiting lists may be exacerbating it. But he raises a very, very good point, and I do agree with him, and that is indeed what the government will be doing, because it's very important to take each individual patient on a case-by-case basis, rather than a one-hat-fits-all, as it were.
My Lords, what action is it?
That for every 13 people working, one is suffering long-term sickness, a record number of people not in work due to ill health. So could the noble lord, the Minister, commit to expanding and tailoring specialist help for those who can't re-enter the workplace due to long-term ill health? And what preventative provision will be made to tackle the increase in mental health issues in young people and the increased incidence of back and neck pain, which we find are major contributors to the unprecedented numbers who are unable to work?
New investment in the spring budget broadens access to additional work coach support for disabled people and people with health conditions, introduces a new supported employment programme and focuses on providing faster access to joined-up work and health support, including mental health and musculoskeletal conditions, the two leading causes of economic inactivity due to long-term sickness. But the noble lady does raise a very important point. The period during COVID has exacerbated all of this, and the system is under pressure. But as I said in my earlier answer, take each individual patient on a case-by-case basis to make sure that help and support into work is the best way to do it. And Job Centre Plus are doing an amazing job on that, working with the health service.
My Lords, we know that food insecurity is associated with poor health outcomes. Professor Greta De Feta has found that for every £1 invested in the Holidays Activity and Food programme, there's a wider economic benefit of £11. Can the noble lord, the Minister, confirm whether funding is available to extend that programme beyond next year?
I'm sorry to the noble prelate. I don't have that information to hand, I'm afraid, so I will write to her with an answer.
My Lords, the nature of the conditions that are keeping people off work has changed substantially. The biggest cause used to be back pain, now it's mental health problems. And this has happened largely since the lockdowns. Unsurprisingly, if you tell people that there's a terrible virus out there, you're going to have more anxiety and more depression. Will my noble friend the Minister consider the long-term impact on health and on mental health before we take a decision of that kind again?
My noble friend raises a very important point, and he's exactly right. Mental health and musculoskeletal conditions are the main issue for long-term sick. COVID and the pandemic meant that a lot of us worked from home in a sedentary position. We weren't built for sedentary positions. We were built for activity. But in terms of the mental health, work always pays, but it also helps with mental health in the long term. So the key is to get as many people on long-term sick back into work.
My Lord, it is now well known that diet is the primary cause not only of early death but of early ill health across the world. 60% of this country eats ultra-processed food as its main source of diet. There is it is not a coincidence. In the last 30 years, we have seen ill health and a rise in mental health problems. This is very new research, but it's very powerfully backed by many scientists. And I wonder if the Minister would consider having a meeting with me and the relevant people to try to understand that if we fed people well, from the moment of pregnancy right through, a lot of this might be averted.
Noble Lady raises very important points, and I am aware of those surveys. I'm always very happy to meet with the Noble Lady.
My Lord, is my noble friend
aware that when I was, as it happens, in the cardiac ward some years ago of St Thomas's, almost all the other men on the ward were there for complications of diabetes. The scale of the diabetes and obesity crises, and they're linked, is one of the major problems of poor health in our workforce. And unless we have, as the Noble Baroness Boycott was suggesting, a more coherent food strategy, encouraging people to eat more wisely and perhaps to increase the regulation of food, we will not solve some of these problems of poor health in our workforce. Does he agree?
Well, I'm very pleased to see that the Noble Lord made a fulsome recovery, and he's exactly right. It is a global issue in the Western world, obesity, and it does lead to health complications that put huge pressures on our NHS.